I'm David Otiashvili, psychiatrist by background. I received my degree here in Tbilisi from State Medical University. Then I spent 10 years doing clinical work here in Tbilisi in addiction clinic. And then I happened to go to US. I got this Hubert Humphrey Fellowship in substance use research. So I spent a year at Johns Hopkins University learning how to do research. And this was kind of turning point in my career. And this year just, put upside down my professional career. I left the clinic when I got back. I established a small research NGO, Alternative Georgia. Then I went to Prague, did my PhD in health psychology. Right now, my interest is substance use research, any kind actually, and education. I'm associate professor of healthcare here at Ilia, and we also are increasingly involved in capacity building of addiction professionals in this country because there is obvious need. What I'm going to present to you, our future study. Okay, let's call it like this. Next week we have committee review next week, so hopefully it will be funded. And it's about primary prevention at schools. It's implementation study. We developed it together with Yale, with Rick and his team. And I'm gonna show you what was the problem we identified, how we decided to engage in it, and what anticipated challenges we have to overcome in the future when the study is funded. Okay. Question to audience. Anyone can tell me in a couple of words what is the drug situation in this country? Are we doing well? Are we doing bad? Just quickly. No, addictologists don't raise their hands. Are we okay? Drug use in this country, everything is good. Yeah, Irakli says he's from drug monitoring center. Okay, he says everything goes well. I mean, something, yeah, really, we are doing okay. I pulled some data, okay, some fragments of data. I pulled them together to get better understanding of, okay, what's going on. This is last year cannabis use in adults, okay? And I'm comparing this to understand the context with EU and US data. This is cannabis use, red columns, Georgia. So there was slight increase after so-called quasi-legalization of cannabis use, which happened in 2018. It's kind of 1% increase, non-significant, obviously, but we are doing better than average European, much better than highest European, much better than US. Yeah, it's 22. Yes, that's legal. I mean, it's quasi legal here as well. I mean, you are not punished for use, but we have huge problem, huge injection drug use, and this is based on the available data, UNODC, and so on and so on. This is the highest prevalence of injection drug use in the world. 2.23 of adult populations. This is huge. If you compare to average European, 0.2, it's 146 for US, 1.4 for highest European, which is in Czech Republic, combined injection and any other problem drug use, any other altogether. So we are really having a huge problem here with injection drug use. Okay, let's look now at youngsters. School students, this is the SPAD survey and monitoring the future for US, and SPAD is analog. I mean, it was developed based on the monitoring future, so data is comparable, obviously. So this is 2015, 2019 after quasi-legalization, again, about 1% non-significant increase and still doing better than average European and better than US, which kind of good. Again, SPAD data, cigarette smoking, youngsters, school students, we are somewhere in the middle. This is European survey, 38 European countries, so we are here. You see girls smoke much less, boys more, but it's still somewhere in the average. Heavy drinking. Alcohol among youngsters is kind of, we are in the middle, but heavy drinking among boys, it's like third place in Europe. So that's a problem, obviously. And here is a slide diagram from our proposal. If you disaggregate the drug use in young population in urban and rural areas in Georgia, you see obvious difference, much higher in cities, large cities, compared to rural areas. Alcohol, nicotine, cannabis, stimulants, significantly, statistically significant difference, not statistically significant, but still higher for MDMA. So we have problems with substance use, and it is more acute in urban population, obviously. So how the country is responding? I said injection drug use, just huge problem. And we are doing pretty well responding to the challenges of injection drug use. I pulled together from different sources data from 2007 to 2022. And this is a coverage of HIV prevention interventions, needle syringe programs, opioid agonist maintenance treatment, about 20,000 clients right now in this country. And this is a huge coverage, maybe one of the best in the world. We have approximately 22, 24 individuals in need, I mean, with opioid use disorder, so 20,000 of them, it's one of the best coverages in the world, obviously. So that's great. And then I asked AIDS Center to give me data about the proportion of PVID-related new annual HIV cases, okay? And I put it here. So it started with about 60% of new annual HIV cases were related to injection drug use back in 2009, you see, and it goes down steadily to 10%, okay? I cannot say it's direct, you know, relationship, cause effect, but obviously the coverage, the scale up of the prevention interventions contributed to this dramatic reduction. What we are doing in terms of prevention of substance use is youngsters, anything, almost nothing. So this is a problem. We have substance use, we have horrible rates of injection drug use in adults, but those adults were kids at some point, right? And we are doing almost nothing to educate, to equip our children with some, I don't know, knowledge and skills to, I don't know, okay, to prevent future substance use. What does science tells us? Literature says that as early you intervene, as better. Also, systematic reviews says that school-based prevention interventions are probably most effective in preventing psychoactive substance use. And when we started to look for the relevant intervention, evidence-based interventions that we might wanted to implement in Georgia, Unplugged. This is European developed school-based primary intervention. Curricula is based on life skills training. It's very interactive, a lot of discussions, group work, role plays, and it helps to develop critical thinking and I don't know, awareness, problem solving, and knowledge about harmful effects of substances. Primary teachers deliver it over the 12 sessions, and they need at least 3-day training to do so. And the efficacy was established in 7 EU countries, but also tested in low middle income countries, namely Nigeria, Brazil, Peru, and Chile. And why we also decided to go for Unplugged, it is translated into Georgian, it is adapted, tested, but not scaled up. Right now, it's done in 8 public health schools only. We have more than 2,000 public health schools in this country, in 8. And it's been like 9 years, as it was, adopted. So less than one school a year. I mean, this is not a scale up, right? And we have our collaborators here at Ilia State University, Jana Otiashvili, who is the head of Institute of Addictology, where me and Irma also belong to, who is actually head of this group who translated, adopted, and piloted Unplugged here. So we decided, why not do we try to scale up and do implementation study to see if Unplugged can be effectively expanded and effectively delivered in Georgia, right? And when thinking about conceptual framework, which we might use for this proposal, we picked up PRISM, right? Practical, robust implementation and sustainability model. Originally, we focused on REAIM, but then, and I mean, the first submission was not successful. We received this, critiques and so on. And then Rick proposed PRISM, and we liked it, obviously. PRISM looks at both characteristics of intervention and service recipients, right? And also looks at the implementation and sustainability infrastructure, which is important. I will tell you why, and external environment, like, I don't know, legislation, some regulations within schools, social norms, and so on, which are extremely important. And another beauty of PRISM is it adopts re-aim measures to measure your outcomes, right? Adoption, implementation, maintenance. Also, we decided to use PRISM for this implementation study. And few just inside, I mean, what is innovative in what we are proposing, we want to try the form of delivery of this intervention which has not been tested elsewhere online. Okay, we will do the traditional standard delivery, but also online by well-prepared professional expert. Okay, and there are many reasons why we want to try if online delivery of Unplugged will be effective. Science tells us that, and COVID period was another proof for it, that many interventions, psychosocial interventions can be effectively delivered online, behavioral interventions and so on. So this is one of innovative elements. Another one is design, use of multi-wave cluster randomized trial, type 2 hybrid. We now know what is type 2. So we will be testing effectiveness and process implementation process equally. So we have effectiveness outcomes and process outcomes, but we also, and again, thanks Rick, it was his idea, obviously, that we will repeat, or this will be 5-year study. So we will repeat intervention 3 times over 3 years. Okay, the same trained teachers will deliver it over the 12-week in year 2, and in year 3 they will do it again with another cohort of students, because the students will be, going to another class. It is targeting the 7th grade students, like age 12, 13. So the same trained teachers will do delivery 3 times over the course of our study, and we will also be looking at the difference if every next year they will do it better. Okay, based on their experience and so on and so on. Challenges, anticipated challenges. So we obviously discussed a lot of potential challenges with Jana, with teachers, with Ministry of Education. And I pulled some of those here, and a good thing is that I pulled them out from just recently defended on Monday master's thesis of our student Nino Tikharishvili, and her master's thesis was studying the problems with low non-scale up of this intervention. Okay, so what we see here, teachers' motivation. Yes, obviously, I mean, they're busy, they're very low paid. Why they want to be trained and then deliver some unknown subject? And we had originally in first proposal P4P arm, okay, pay for performance for teachers. And then we removed it for this resubmission uh, because of the sustainability issue. Okay, we got the critiques that this is, like nice idea, probably it will work, but in terms of sustainability, we cannot show that after the study if this delivering is successful model that it can be retained, uh, teachers' confidence in delivering unplugged fidelity, and this is huge issue. I will tell you how we are going to address the fidelity, how we are going to monitor the fidelity. I mean, you can train teachers, and then there are 12 weeks, 12 sessions. They are in classroom with students, and how do you know if they covered everything that is needed, if the dosing was appropriate, and so on and so on, okay? So fidelity is a huge challenge also based on the results of previous studies in low middle income countries as well. Difficulty of inserting program module into the lessons grid and the problem of finding time and space. I mean, very often there is no space for this weekly 1 hour session. I mean, when it should be done, because there is a curricula, approved program, and so on. So how technically this should be implemented? Parents' awareness. We didn't think about it, Rick, during the proposal development, but this came out from Nino's research. Parents' awareness. I mean, parents might be against it. Yeah, you are not gonna talk to my kid about sex and drugs. No way. I mean, oh, really? Didn't they know there is internet or whatever or other sources? Yeah. So these kind of challenges that we will be probably facing during the implementation of this study. And here is a nice, I love it, diagram. Rick should be credited for it. Beautiful diagram shows entire process of this implementation study. So we have two aims. First, can we call it formative? It's rapid exploratory sequential mixed method assessment. Sounds much better. Yes, obviously. So it's surveys, focus groups, nominal group techniques with teachers, students, parents, everyone, every stakeholder that might be involved and interested in this project. And then we move to aim two, which is actual cluster randomized trial, 75 schools, Tbilisi, Kutaisi, Batumi, randomly selected and allocated to 3 arms. Online expert delivery, this is innovation, never done anywhere. Primary teacher delivery, kind of standard unplugged delivery model, and standard of care. So we will have 15 schools as a control group. We will just measure our outcomes, but we will not intervene in these 15 schools. Okay? And then we have 24 months timeline for assessment, process, outcomes, teachers, students, bunch of different approaches of getting feedback, providing technical assistance, and so on and so on. Sorry. And then we have outcomes, primary outcomes, effectiveness, substance use, obviously. It's combined substance use, and the maximum period that we were able to put into proposal is 24 months. Okay, 2 years, which is okay. I mean, 6 months, but also we will follow them up for 24 months. And then secondary outcomes, separate use of nicotine, alcohol, and drugs, and implementation outcomes. Primary outcome is fidelity, intervention fidelity, how well teachers will be delivering the intervention based on the protocol, let's say so. And second, adoption, satisfaction, both with students and teachers, okay? So here is a list of some measures that we've developed and approaches how to make sure that the data that we will collect, the process will go as planned, but also data that we collect will be of high quality, training of teachers, obviously. And I mean, we realize we need somehow to motivate these teachers. And there are a lot of details that are out there in a proposal, not displayed in this slide. For example, 3-day training, yeah, we put money to bring all those teachers to nice place, I don't know, Lopota, Kachreti, whatever, Tsinandali, nice, like four-star hotels at least, and let them to enjoy, not only, to learn, okay? We hope to have continued executive sponsorship from Ministry of Education. We got letter of support. They are supportive. They say if your trial is effective, we will discuss possibility to adopt and expand and so and maintain the intervention, which is good. We hope that they will keep this commitment. So there will be, I don't know, should I say order? No, instructions. I don't know. Advice from the Ministry of Education to work with us. We also put, these are details, but really practically important. We also put in a budget some donations to every school who will be part of this project. We will be giving, I think it's $1,000 annually to every school who will be part of the project, just to buy, I don't know, computers, maybe whatever school might need, okay? So the executives of the school are also interested to work with us and so on. These are all pretty important details. Quality improvement, fidelity, how should we be sure that teachers really do what we expect them to do? Obviously, we will be having this standard checklists. After every session, they will check, did you deliver this? Did you spend 10 minutes on group work or whatever? This is pretty standard. But I mean, still, is this enough? We will be recording every session. We will be recording. I mean, online sessions will be recorded anyway because they will be delivered soon. But in classes, we will be recording every session, and teachers and students will know it. We will get consent, and then we will be checking randomly 10% of this recording for the fidelity and also for the convergence. What is the English term? With the checklist that they will be filling out. Regular site visits to schools, discussing the problems, issues, challenges, technical assistance. Our team and experts will be available for them for any questions, any issues. And, I mean, this is pretty regular details of the process when you do implementation. And yeah, that's pretty much it about this proposal. I will be happy to answer any questions that you might have. Thank you for your attention.